Good morning. This is Dr. MD Rahimullah Miah from Bangladesh Northeast Medical College. My presentations on impact of sensor networks towards individual augmenting causes of diabetes. Today, global conference on diabetes and endocrinology. My research title comes from my PhD research. Aim of the study. The aim of the study is to explore the identifying causes of diabetes due to misuse of processed wireless sensor technology. History of the research. I developed a formula called ISNA effect from my PhD research work at University Malaysia, Sarawak. I tested it between cat and dog at a fixed and changeable GPS locations. From the experience, I identified above 362 sensor disease. I mentioned here CASIT, common acute sensor infections and disorders. ISNA implies means impact of sensor networks towards animals and human beings. There are some CASIT like diabetes, ISNA disease, after called coronavirus disease by WHO 2020. Cardiac arrest, tracheal cancer, ARDS, multiple myeloma, CKD, stroke, and so on, which is published in international journal. I mentioned here reference. ISNA formula from my PhD research. This means due to active sensor technology, every human, animals, or object is affected by the processed radio frequencies of its movement through electromagnetic transmission within the boundary of the body in the GPS or GNS coordinates. This effect is proportional to its weight factors and disproportionate to its GPS positions and GNSS distances. GNSS means Global Navigation Satellite Systems. As a result, the person, animal, or object is damaged by the fluctuated frequencies. And for recovery systems, the living object or living animals should change instantly from the existing location with tightly closed eyes and set up secure network control unit. This article also published in international journal. ISNA effect on diverse parameters. Impact on human beings, particular CASIT, impact on animals, plants, objects, impact on doctors, patients, guardians, impact on medical and other institutions, impact on environment, climate, and state, impact on others, testing individuals at a fixed GPS locations. There is one procedure, ISNA. First, any object, any animal or plant or human beings stay in a fixed location with open eye or voice or GPS location. Then the person can be detected with telematics, sensor telematics device. Then he scanned automatically, recognized with connected electromagnetic force. Human beings contain in eyes electromagnetic force and voice and atmospheric frequency connected, and everybody scanned, whole body is scanned like MRI. Then every organ is transparent in device. Then this organ select and blocked and transmitted like tracking towards as the picture. If the organ is blocked, then electron transmission is cannot active. So electron transmission blocked, then the again tracking the body or organ is static and digital poisoning. If digital poisoning, the electron or liquid materials cannot flow one organ to another organ. That means blocked. Then blocked, the due to depend on human bodies, either BMI category, underweight or normal weight or excess weight. Then he suffer electron movement. If the device connected and blocked in pancreas or urinary organs, the pancreas cannot active, and this process active on clouding sensor clouding system. Like due to active open eyes, individual's voice, sensor device and staying at a fixed GPS location, sensor MRI scan pancreas with in-body GPS sensor device, tracking the selected organ, either pancreas or urinary organ, blocked selected organ, barrier to transfer electron, then digital poisoning the selected organ. Then individual suffers frequent urination due to not sensor tracking. One person only. If more person at a glance, then tracking with distributed sensor tracking. This frequent urination continues several times due to switch on at sensor clouding device. This switch outside, not in boundary. Then he suffer in urinary infection. This urinary infection continue more and more several times, then is urinary infection convert into diabetes. This diabetes, sensor diabetes. I mentioned here sensor diabetes. These digital clouding systems and diabetes connected with different parameters, different environment. If this person who affected sensor device, if he stay here Dhaka, then he go to Singapore, then who go to Abu Dhabi or London or New York, they are also, because they are also he suffer this clouding system because his eye open, his voice active, his electronic device, mobile phone or other electronic device or GPS is active, so can be detected, and this location can be easily poisoning, either laser sensor or radar sensor or other sensor, electronic device. Diabetes effect on health. This diabetes has created more terrible situation than a global health crisis in various ways. This is having a devastating effect on the world health community system and economics. Most of people cannot find how to recover this diabetes because he has no idea the sensor device blocking or sensor device tracking or sensor device electronic poisoning. The findings overall, sensor diabetes situation is the top risk unexpectedly at national, regional, and global conditions, global economics, health economics, or environmental economics. Depend on diabetes on obese, underweight, or normal weight, or excess weight. Maximum overweight obese person can be affected in dark condition, then underweight or normal weight, for my research. How to, if his pancreas or urinary organs is affected by electron sensor, then he cannot active his urinary infection. Then he suffer long time due to sensor poisoning. Overall, the frequent urination and diabetes occur through the misuse of wireless sensor technologies. These sensor technology cannot active due to lack of secure, lack of awareness. Besides, he use handphone, but handphone is not problem, but problem his GPS location. His handphone is not secure due to globally active sensor network, GPS network, global navigation satellite network. Users use cell phone and voice at fixed GPS location. Maximum time, most users use bedroom or office room or fixed room, but he has no idea the fixed location is selected is for tracking or poisoning or digital tracking. For this purpose, lack of users have no use person area network control unit. Overall, as a doctor or other person or senior executive or prime minister or president, he is not secure due to misuse of sensor technology. If the executive person have rapid action battalion or army or police or other security force, he is not also secure because he is stay in open active sensor network. So open active sensor network, but not secure, not control area. He is also either prime minister or chief executive can affected by diabetes or other disease, which I mean CASIT, common secure sensor infection and disorder. Besides, sensor bouncing activities in the society, in our environment, in our site or other quality part. So if one use mobile phone or other sensor device, he can affect it by either sensor GPS or global navigation satellite systems. For this purpose, his every body organ or his site factor or environment can be affected by either blocking or sensor tracking. For this purpose, how can control? We can control easily. For this purpose, when I feel frequent urination, I must move the location, existing location, close the eye and sense my location and switch off my active device, sensor device. For this purpose, instant or frequent urination can be controlled. This is one not sensor device, but it is not active distributed sensor device. For distributed sensor device, must use personal control unit device. Another way for recovery, if anyone body can close tightly close eyes, then he wear sense location, GPS location, and use anti-radiation sunglass. Then he use according to doctor's advice. He is recovery diabetes, but some doctor cannot agree that diabetes is common disease and cannot recover. But from my research, I mentioned diabetes can recover and recover and recover. No confusion this. But there is challenge. What challenge? Potential health issue at national and global levels. Insecure in-body GPS sensor, digital body burning, digital corruption and object destroying, digital killing, either trachea or lung or pancreas or heart or entire body. So it is risks. There are also every person can be affected by sensor tracking. Everybody. From my research, above 362 disease identified from sensor tracking. Today, corona is also one type of sensor disease. So if anybody can affect it suddenly, CSD or insomnia or diabetes or other disease, cardiac arrest, he must change place instantly, closed eye, then anti-radiation sunglass wearing, and he accordingly, he automatically, sometimes maybe 5 minutes to 12 minutes, he can recover. For my research, what is the novelty? Wireless sensor networks is uniqueness, affect in national, global economy, health economy, or other perspective. Disseminate the distributed sensor network to the entire society through node and distributed sensor wise, but no secure. It is the cause of deadly socioeconomic horrors in diabetic situations. Diabetic crisis has exacerbated structural weakness, social instability, widened economic inequalities, neglect the ethical rights, degraded employment, disrupted human capital savings, and increased the infodemic phobia. So what's potential? The potentiality it can enhance secure systems for individuals, health professionals, doctors, nurses, scientists, researchers, and other stakeholders at national, regional, and global levels. Experts have tried to implement ways to reducing their impact by encouraging pertinent institutions to go competitive market with advanced sensor technology to recover diabetes, non-communicable disease through alternative potentiality. Long-term sluggishness or declining per capita income can lead to social unrest and challenge the target-oriented goals for sustainable development goals. For this, United Nations can support to the member state like WHO, World Health Organization. Large potential on socioeconomic recovery parameters use, including learning, research, servicing, and access benefit sharing to achieve specific goals related to national healthcare policy in connection with sustainable development goals. Maximum person cannot idea the sensor technology impact. So if awareness can be built up, the potential can be developed. Future research trajectories. As a new technologies continue to emerge, doctors, patients' role will continue to evolve with each advance, bringing a safer and healthcare future for both physicians, patients, and the state with secure sensor technology, economic support, and sustained living style. As a medical doctor, health professionals, economists, businessmen, researchers, scientists, engineers, and others can continue to make leaps forward with these innovations. More lives with the safe as more research will receive assistance. There are some recommendations. First recommendations must aware. Everybody must aware impact of sensors networks, impact of sensor technology, impact of sensor device. If doctors or nurse can be aware, patient also automatically aware. They should share the applications of emerging technologies towards relevant research practices as a regular basis. Particularly wireless sensor network must aware. Should improve sensor technology security system in connection with national health policy. Conclusion. Today's world is a mix of society, science, and economy with innovative technology. Innovative technology is good, but somebody misuse this. So misuse must aware. Everyone use this innovative technology with easy, instantly communicate in different countries, entrance, researches, and much more. But it is also a deadly effect in daily life, which is no one in the society try to know, come forward to know which is the effect of coronavirus or diabetes or sensor disease worldwide, linking the misuse of advanced sensor technology. As a result, there will be a change-making cycle in the needs of the people, and it will spread from national to global. There are some acknowledgements from my research. I also acknowledge to Scientex events for giving me presentation opportunity. My institute, Northeast Medical College, UNIMAS, Malaysia, and ICT Division, Government of Bangladesh. There are authors, this research. There are some difference. So every doctor, nurse, and patient must go ahead and cooperate each other. Like friendship, every disease can remove, can recover. No tension. Do action, please. Thank you. If any query, please.